Good morning, doctors. Today we are going to discuss about cardiac arrhythmias. Very important topic. Question number 70. Most common mechanism of tachyarrhythmia. The most common mechanism of tachyarrhythmia is re-entry. C option is right. Question number 71. Most common benign cardiac rhythm is it's atrial fibrillation. B option is right. Question number 72. Which of the following is a sinoatrial disease? See all four options in front of you, and the answer here is sinoatrial means P wave present a disease. It is sinus arrest. 72C answer. Sinus bradycardia is defined as the heart rate of. So, firstly, you have to know the normal heart rate. Normal heart rate is between 60 to 90. Below 60, it's bradycardia. Above 90, it's tachycardia. So, here it's less than 60 is bradycardia, sinus bradycardia. Question number 74. Treatment of asymptomatic bradycardia is if there is a bradycardia, heartbeat is less than 60, patient is comfortable, patient is stable, maybe he is chronic bradycardia, so no treatment is required here. No treatment. A option is right. Okay. Question number 12 of 75th. A 12-year-old wheelchair bound boy with scoliosis has presented with dyspnea. ECG shows sinus tachycardia with tall R in lead V1 and deep S wave in V5 and V6. The probable diagnosis is here, see all four options carefully, and answer is B. It's Duchenne muscular dystrophy. Okay. Question number 76. Patient of first degree heart block complains of dizziness. Best treatment for this patient is first degree heart block, dizziness. So treatment is atropine A. Okay. Question number 77. While at the ward round, you see an elderly lady attendant slump to the floor. Going to her aid, you notice her to be unresponsive and a panic. Your first step in adult basic life support should be the following. See all four options, guys. Here you have to determine the responsiveness. Firstly, you have to determine responsiveness. Okay, C option is right for 77 question. Now let's discuss more MCQs. See this picture. Question number 78. This picture, it's visible. What is it? It's an cardiac resynchronization therapy. B option is right. Question number 79. Which is the incorrect about a pacemaker deployed below skin of the chest? Of course, yes. B. Pacing lead lie in right atrium and right ventricle. Of course, yes. B. And treatment of choice in morbid type 1 heart block. This is the false for pacemaker. D is biventricular pacing is useful for dilated cardiomyopathy. Of course, yes. So here the answer is C because they are asking incorrect statement. Okay. Question 80. A 70-year-old hypertensive patient with complaint of palpitation and pre-syncope on examination, heart rate 72, it's normal, blood pressure 152 by 100, ECG is shown, blood pressure little bit higher, ECG in front of you. So this is, guys, see atrial flutter ECG. Okay, next video. Question number 81. A 62-year-old male with underlying COPD develops a viral upper respiratory infection and begins taking an over the counter decongestant. Shortly thereafter, he experiences palpitation and presents to the emergency room. where the given rhythm strip is obtained. Demonstrate. So see this ECG. This ECG represents B option atrial flutter with 2:1 atrioventricular block. So B option is right here. Okay. Question number 82. All of the following are the true about atrial fibrillation except here the except if you are going to see. So answer here is risk of thromboembolism, of course yes. Digoxin for treatment, yes. Cardioversion followed by anticoagulation, this is the wrong here statement. Okay. Ectopic originating the pulmonary vein, yes. C option is right here. 783 question. A 78-year-old male with hypertension, controlled and antihypertensive drugs present with new onset of mild left hemiparesis and finding of atrial fibrillation. Which of the following must be done? See guys, here question number 83rd. So you have to give warfarin in such condition. D. 84 question. Digitalis is used in mitral stenosis when patient develop. So guys, here the answer is atrial fibrillation. Question number 85th. Most common arrhythmia in ICU patient is, this is atrial fibrillation. 86. Atrial fibrillation may occur in following condition except. Atrial fibrillation can occur in all except hypothyroidism. B. Question 86 answer is B. Question 87. Which of the following arrhythmia is most commonly associated with alcohol binge in alcoholics? So guys, what do you think? Here the answer is atrial fibrillation. 87th. Question number 88. All of the following features can differentiate between ventricular tachycardia and supraventricular tachycardia. Except. Question number 88. Except the answer is ventricular rate is more than 160 beat per minute. Question number 89. All of the following electrocardiographic findings may represent manifestation of digitalis intoxication. Except. So 89 answer is multifocal atrial tachycardia. Question number 90. In ICU, a patient suddenly develops unresponsive, pulseless and hypotensive with cardiac monitor indicating ventricular tachycardia. The first therapeutic step among the following is go for defibrillation at 200 joules by phase 6. C option is right. Broad question number 91. Broad complex tachycardia due to ventricular tachycardia is suggested by all except. It is suggested by all but not by termination of tachycardia by sinus carotid massage. If a person is having ventricular tachycardia, extrasystole appears to QRS complex. B 92. A 40-year-old male presents to the office with a history of palpitations that last for a few seconds and occur 2 or 3 times a week. There are no other symptoms. ECG shows a single unifocal premature ventricular contraction. The most likely cause of this finding is idiopathic. It's idiopathic. No one knows. Okay. Question number 94. In a patient with wide complex tachycardia, the presence of all of the following in the ECG indicates the ventricular tachycardia except. See all 4 options. It's except is typical right bundle branch block. Question number 95th. Which of the following statement about premature ventricular beat is false? So here answer is prevalence decrease with age. C option is right. Drug of choice in maintenance therapy in PSVT is, this is verapamil guys. C option 96. C is a right. Drug of choice for paroxysmal supraventricular tachycardia, it's adenosine. C 97 is C. A patient develops sudden palpitation with heart rate 150 beat per minute, regular rhythm. What could be the cause? Here the cause is, see guys, all four options, and answer is atrial flutter. So guys, this is also a very important topic. If you still not subscribe my channel, please subscribe it. For more updates you can click the subscribe button and a bell button. And have a good day. Goodbye again.